Hi, I'm Marty Salt, and you're watching WFTV.com's Care Connect. A cancer diagnosis is stressful and, of course, scary for the patient and their family. Knowing you have an expert to guide your treatment and recovery makes a big difference. Here to tell us more is Dr. Maria Ruiz. She's a gynecologic oncologist at UCF Lake Nona Hospital. That's a part of HCA Florida Healthcare. And welcome so much, Dr. Ruiz. Thanks for being here.
Thank you for having me.
First of all, explain exactly what are gynecologic cancers.
Gynecologic cancers start in the women's reproductive organs. They can be diagnosed as early as 20 years old or as late as 90, 100 years old, but in average is about 50 years old. Some of these cancers can be preventable, such as some cervical cancers. Others can be not preventable, such as some ovarian cancers.
And are there common symptoms?
That's a great question. Those are difficult to catch because, unfortunately, gynecologic cancers have very vague general symptoms in general. So, for example, if you have pelvic pressure, pelvic pain, nausea, vomiting, it may not be attributed necessarily to gynecologic cancers, but certainly those are symptoms that you may have. So that makes it a little more difficult to diagnose. At the same time, there are options to be able to control that and catch it early. So that's why you need to see your gynecologist as soon as possible when you have any of the symptoms that are persistent.
And if you could briefly explain, how do you treat these cancers? What's the most common?
Of course. So treating these cancers are very specific to the origin of the cancer, the type of cell, and how far it has spread. Therefore, that makes it unique to yourself. So we make a plan at HCA Florida Healthcare to make sure that the plan is for you, not just a general kind of guideline. It's very specific to your cancer and you as a person. So, for example, surgery is usually part of the management, in other words. Sometimes chemotherapy, sometimes radiation. It just depends of what it is and how far it has spread.
And is there a way to actually prevent some of these cancers? I know there's specifically the HPV vaccine.
Yes.
Tell us a little bit about that.
Absolutely. So the HPV vaccine is great at preventing some of the HPV-led gynecologic cancers, such as cervical cancer and such. That is important, and that's something that we encourage any girls older than 9, as old as 45 years old, to also get, whether you have had any sort of masses or not, or abnormal pap smears or not, that you get, so that you prevent any future recurrence of abnormalities or cancers.
And something a lot of women would want to know, is there an age that I can stop going to the gynecologist?
I would also want to know that, but no, you cannot stop seeing your gynecologist. Please don't. At HCA Healthcare, we want to make sure that you continue to see your gynecologist every single year to catch any abnormalities that you may have early, and hopefully we can manage it with only surgery, and therefore hopefully you don't need chemotherapy and radiation. We can also catch other symptoms that you may have for other conditions, and hopefully that can be better managed with less invasive procedures.
Right, yeah. Good idea to stay in touch with your doctor. So thanks so much, Dr. Ruiz. And if you would like to learn more about comprehensive health care available in our area, or to find a location near you, visit HCAFloridaHealthcare.com. I'm Marty Salt, and thanks for watching.